Hi, I'm Dr. Kelly Harding at Columbia University Medical Center, and I'm joined today with Dr. Arthur Barsky of Harvard Medical School, as well as Dr. Brian Fallon of Columbia's College of Physicians and Surgeons. We are putting together a series of segments on hypochondriasis, and this segment is actually focused on the history of hypochondriasis, which I believe, Dr. Fallon, you were going to talk about.
Yeah, I'm happy to tell you what I know about the history of hypochondriasis. The term itself, when you think about the term, hypochondria, hypo means below or under. Chondria refers to the cartilage of the ribs. And isis is inflammation. So it's inflammation of something below the ribs. And uh, it was actually, the term was coined by Hippocrates uh, in the 5th century BC. And it was an anatomical term, actually, because it referred to a particular site. And in those days, they believed that the cause of all diseases emerged from area below the ribs, either the spleen or the liver and the gallbladder or the stomach. And so people with illnesses were referred to as having it in the hypochondrium.
Huh.
And then Galen, who was one of the early physicians in the 1st and 2nd century, actually started to refer to hypochondriasis, which is, and hypochondriacs, which are those people who suffer with an excessive worry about illness and they can't get it out of their heads. And oftentimes they're suffering with concerns about digestion. And later on, it sort of evolved into a sensation that in the Renaissance, actually, it became a disease of refinement. And those people who were especially creative or intelligent would be those who suffered from hypochondriasis. So it was a mark of having extra time on your hands where you could worry. So it showed that you were from the aristocratic class. It showed that you had refined sensibilities because you could actually feel things in this special way that others couldn't feel. So it became a mark of distinction. So in the time of the Renaissance in the 15 and 1600s, you were proud in many senses to be a hypochondriac. There was a book called The Anatomy of Melancholy, written in, I believe it was either the 1500s or the 1600s, by Burton. And in that book, he talks about different kinds of hypochondria. There's melancholia, which is sadness. There's love melancholia, and then there was hypochondriacal melancholia, where you worry too much about illness. Uh, so everybody wanted to be a hypochondriac because that showed your creativity. But then, as clinics emerged, health clinics, and the poor started to be cared for as well, it became clear that the poor also had hypochondriasis and also worried too much about illness when they didn't actually have an illness. So then the higher classes didn't think it was so cool anymore to be suffering with hypochondriasis, and so it became less a mark of distinction and more a problem that was shared by pretty much everybody, which is that you don't have to be rich or poor, but everybody can suffer from hypochondriasis. Um, it was often said that men suffered from disorders of the spleen, and I think they were called splenetics, and the women suffered with disorders of the uterus, and they were called hysterics. Uh, So over the years, especially the 1800s, as the germ theory came out, we learned that there are actual physical causes for diseases, and a lot of diseases that we previously really had no idea what the cause was, and it was this vague notion of humors below the ribs. Actually, it wasn't caused by humors below the ribs, but it was actually caused by a bacterium. And if you could find exactly which type of bacteria it was, you could hopefully treat it and get people better. So in the 1900s, obviously, we developed such better forms of medicine so that in the 1900s, it became clear that those who suffered with hypochondriasis actually weren't suffering from a specific medical disease that could be isolated, but they were suffering from the fear that they had a medical disease. So in the past, they would have been brought into a medical hospital and left on the medical ward because they were suffering from their disorder of hypochondriasis. Now they would not be admitted at all to the medical ward because it was clear that they weren't suffering from a identifiable, treatable medical cause. So the psychiatric community in the um, actually late 1800s and early 1900s started to pay more attention to the fact that grief and stress and a variety of causes, etiologies could contribute to someone becoming a hypochondriac. Um, there was this phrase that a British anatomist, no, actually, I think it was a British psychiatrist, Henry Maudsley, coined, which is uh, um, the grief that has no vent in tears makes other organs weep. And that phrase itself points to the awareness that was present in the early 1900s that unresolved grief can cause other organs to weep, and you'd actually feel the pain in your organs, but not necessarily uh, consciously aware that it was grief that was causing your physical pain. So in the 1900s, with Freud and other great psychologists, we learned that psychological causes can cause somatic symptoms, and the American psychiatric community created the Diagnostic and Statistical Manual and came up with the term hypochondriasis with the defined criteria. When was that, Arthur? In 1980, maybe the DSM.
DSM-3?
DSM-3 was 1980.
80?
Yeah. So, and the criteria for hypochondriasis are basically the fear that. Go ahead. You go through the criteria.